Hello, everyone, and welcome back to the Empower Podcast. This is episode 22. This is a podcast run by healthcare professionals for healthcare professionals with the goal of raising transparency and awareness, with a continuing goal to have legislation passed in the state of Colorado and throughout the whole United States mandating employers to provide and support employment and employee wellness programs through a minimum of at least 8 wellness days. We have a little modification for all healthcare professionals per quarter, a minimum deposit of $2,000 in an HSA account per quarter, and the establishment of an anti-retaliation department run by a third party. At Empower, we believe in the power of unity, diversity, and inclusivity to create positive change and improve society. Our podcast aims to amplify voices that often go unheard in the community, through healthcare, and beyond, through individuals and organizations who try to make a difference in their communities and also beyond that. Through these thought-provoking conversations and inspiring stories, we strive to continue to raise awareness and promote action through a more equitable and sustainable healthcare realm throughout the world. Join us as we explore new perspectives, change assumptions, and work towards creating a brighter future for all. Again, we are on all platforms. You can go ahead and check out our bio link. That's bio.link. That's Lima, India, November, Kilo. So bio.link/Empowera. And we understand Empower. That's Echo, Mike, Papa, Oscar, Whiskey, Echo, Romeo, Alpha. That's it. And beyond, all your links and stuff are there. YouTube in general as well. Today we have a new guest. We have, what is your name?
Crypto Matt.
Crypto Matt. Hey, thank you for joining us, Crypto Matt. And Crypto Matt, where are you coming to us from? Across the airwaves.
We are coming from Ohio.
Ohio. All right. Well, thanks for joining us. Let's see here. We encourage, again, our listeners to share their experiences anonymously. If they'd like, can we have that email as well? If you're interested as well, that's Empowera1. That's the word empower. Then the letter A is an alpha, 1@proton.me. Let's see here. All right, everyone. If you go ahead and, at the moment here, if you can follow us or hit the doobly-doo, I've been told as well. Go ahead and subscribe so you can stay up to date with these overall updates throughout that, because we're also creating our own Patreon as well at this current juncture. We're about to roll it out here soon for different tiers for different people. We've been able to give back and power as we can since March. We're going to continue to do that, so we want to keep this going. All right, everyone. Sit back, be yourself no matter what, and get ready to be empowered. Okay, Crypto Matt, this is the part where we give a big thank you out to the members of the community, whatever they may be, in healthcare, out of healthcare. They're truly number one. You know who you are. You make a true impact on us all, and we love you. Speaking for me, if you want to speak for you too, Matt, Crypto Matt, we can do that. But is there anyone special?
Really, just all the nurses out there. I know you guys do an incredible job. Really, just everybody in the healthcare professionals. I'm an IT, and I couldn't even imagine what it's like to take care of people, especially people that are probably grumpy and not feeling good all the time. So a big shout out to all of you. You guys really are the heroes of the world, and I appreciate everything you do for everybody in wellness.
Thank you for that. I appreciate that. I don't speak for everybody, but I felt that. Usually throughout the show, I get to certain parts. This is it. I'm already feeling it. And it's part where I ask myself, Brett, does this guest make you feel empowered? And yes, Crypto Matt, you make me feel empowered. So thank you, at least for me. All right. So kind of restructuring this a little bit, everybody. From Power, I got some great feedback. Thank you from the community. Continue to love that. Keep that coming in. Want to provide the best that we can for you and most up to date when possible. So Crypto Matt, you want to talk maybe around the overall integrity for you, of healthcare?
I think healthcare is going through a major change, just like every single field that I can imagine right now. Really, it's the empower the workers. Before, I think the 2020 pandemic, really the companies and employers kind of had the power, where after the pandemic happened and there was worker shortage, not just in healthcare, but worker shortages everywhere. And healthcare is obviously put in the spotlight because during a pandemic, healthcare is overwhelmed because everyone's going to the hospital, et cetera. Now that workers kind of have the power and they can choose where to go. and they can pretty much choose everything, maybe not necessarily their exact salary, but it seems like most people, if they would want to leave, they should be able to get a raise. So I think they're kind of at the same point where everybody is, where right now we're just going through a major change for the people, and I think the workers are going to continue to have the power.
And then with that, I guess, and you're kind of touching upon it here, I think is that, what in your opinion then as a result of that, I guess would be, is what is happening in healthcare? You know, as a result of this, seeing what you're seeing from even being a community member, to answer that overall question is what in your opinion is really happening in healthcare, maybe as a result of this that you've seen?
I'm thinking we're starting to see a shortage in places where maybe we're seeing lower salaries, and not just salaries specifically, but maybe places that did massive layoffs and thought that they could maybe recoup that. And then when they realize that other people can just kind of switch jobs and get paid more, that they aren't able to replenish. I think also working remotely has a huge satisfaction for a lot of workers, even in healthcare, and it may not be the easiest because, you have to take care of people. So how do you take care of people while also do it remotely? There has to be kind of a happy medium there. But I do think the working remote life is definitely making an impact as well.
Wow. Yeah. I mean, and even from other guests I've had on the show, if I can share, thank you for sharing that. I want to acknowledge that it's better input, I feel, at least this time, from the community, because like you had talked about, there is this transition that's happening. And I mean, I'm not the only one too that's declared it, but like other healthcare professionals too are declaring that we're at this juncture in time, the way that healthcare is, like, we don't want to work for a lower pay, like you had said. We don't want to work the bedside for that, at least for that. And it's not beyond that. We're looking for other possibilities for employment. And what we're up against too, and I'm saying this on the show too, is from personal experience and from those that I'm hearing from other healthcare professionals trying to transition, it is that overall inability. There's a delay in the overall employment. I mean, I said it before on another episode. I'll say it again. There's the picture that was of the current king of England, and it was him back as like a young lad, a younger guy, and it was black and white. And then it shows him now, a picture of him on the throne, and it says like when you applied for the job, when they got back to you. So like, it's kind of that kind of a system too. But there is a demand. Like, I mean, yeah, wow. And just the overall amount, this transitioning too, and I don't know if you wanted to speak to this, I feel like you'd be a good guest for it. But like with the integration of AI, like it's already been integrated. I know, the Cleveland Clinic, and this was public record, they were using IBM's, Watson back in like 2017, I think 2018. So like, and there's servers up in Cleveland that I don't think it's been published. It has, but it hasn't been like blown out. If anything, there's these things now I'm finding out, mainly with spacecraft, and then I'm going off topic here kind of folks, but like, there's certain verbiage that has been used not only for legislation of the general public, but that and beyond. And there have been what are called disinformation campaigns that have occurred from the U.S. government and other governments throughout the world when it comes to certain topics. So I appreciate you wanting to share what I'm thinking is true. It's the truth. This is what's really happening. And I'm not seeing articles about it in the news when I'm looking. I'm not seeing this. I'm seeing projections for the end of the year. Like anything, any other business throughout the world is that overall projection, but no actual endpoint, to see that. And the means, there's the ends and the means, and the ends have been stated, but the means for those to happen they're happening at the moment, I feel. I mean, what do you think?
I would agree. AI is definitely, I don't want to say it's going to be taken over or anything crazy like that, because, this isn't Hollywood, but I do think AI is going to take at least 5% of most jobs, healthcare included. Yes, I saw the Cleveland Clinic. I don't know too much about that other than that they were working with IBM Watson. Mm-hmm. Not exactly sure how in depth and how much they were using him, right. Or it, I should say.
Well, what
I have been researching is I believe there are AI robots right now doing surgeries that I think before had like 80 to 90%, like 90% rate. Right. Where now when the AI is doing it, I think it's like above 98%. I think open heart surgery might be one of them, just because there's always things that can go wrong. Nothing against humans, but sometimes robots can't just do things better than humans. And I think when they figure out what the AI and robots can do much better than the humans can do, then hopefully they will do that. And then the humans will be able to kind of focus on the things more or less that they don't have to worry about maybe open heart surgery as an example. I'm not saying that that's for sure going to happen, but just an example that I can think of.
Oh no, that's one of the top surgeries. I mean, coming across an OR is an open heart, or if they can, they'll minimize it with smaller preventative measures, which they can, and I admire that. But at the same time too, I think it's literally up to the patient to see what they can really do and what they want, but that's a whole other discussion. When it comes to that, but wow, those are quite some I mean, the one that I had saw, and I'm glad you shared that. I didn't know those. I'd love to look more into that and share on that. What I had saw was there was more like is diagnostic stuff. Like they were legitimately doing like 3D kind of stuff, like projections of the inside of a human, like almost like X-ray, CAT scan. Like we've seen the regular pictures that are kind of, for me, they're kind of blurry, right? They look like a blob or this or that. But with this, they literally looked clear and you could see everything. Like you could see a 3D looking of what a tumor would look like inside of somebody. And this was back in like 2018. So like, we've got to come some distance. I haven't seen real publications. I'd love to look for them. I'm sure they're out there. And I'm just, getting back into this since March. I'm trying to turn this up, be able to provide this for the public too. But wow. So I guess with that, this is part two, community-wise. This is the part where we call it the shout out to the integrity of employment. So I guess this is where we kind of address and say like what maybe hasn't been addressed in society or, that haven't been addressed fully. And this is to the overall shout to the employee wellness programs, just in general. So I guess for me, just your overall thought on that and the way that looks. And would you mind even sharing what your current employment status is?
I'm currently a business owner that does crypto. I trade and do crypto mining. So that's kind of what I do right now. My biggest coin right now, just as a throwback of what's going on in crypto, Kaspa, KAS is the ticker, is kind of my number one right now. Anything could happen, so this isn't financial advice. Tomorrow it could be 10x or it could buy by 10.
Oh, yeah.
But I do think Kaspa has a good future just because of the utility of the block DAG, which is super fast and not high-powered transactions. So hopefully it continues, the miners continue to make money and the people buying it and selling it continue to make money. I can't guarantee that the price is going to go up or down, but I personally am investing more and think Kaspa has a bright future.
Wow. Yeah? Again, yeah, like he had said too, this is not financial advice. I mean, I've said that on multiple shows, not financial advice, not medical advice, not nursing advice. This is literally just you sharing your own meandering experience, right?
Yeah, this is just personal conversation. Really nothing to be taken. I'm not a medical doctor, so anything I say is not medical advice. And I'm also not a crypto expert.
And a lot of the stuff that you do too
is... I think I know a lot. I'm definitely not no expert or a programmer. And this is not financial advice, so don't go out and spend $1 million on Kaspa because you think I said to. I did not. But definitely do some research into it. And if you are in crypto, maybe put it on your watch list and see what it does for you.
Yeah. If you don't know what a watch list is too, just literally a lot of the stuff that I've learned and Matt has learned, I can say this is just public record, right? A lot of stuff's out there on YouTube, the web. Yep, cool. All right. So anyways, going with that again, can we talk more about integrity? So like you said, you're in your own business. Like, can you stand for that? Why do you choose to have your own business?
One of the reasons I choose to have my own business is because of the COVID-19 vaccines. At the time that they were released, a lot of them were being mandatory. Even for somebody who was applying for work from home jobs, they were still mandatoring me to get the vaccine, specifically the COVID-19 vaccine. I just was not at the spot where I thought that there was enough data to choose to take 2 shots and I guess the booster shots if I would have continued. So, me personally, I am not vaccinated with the COVID-19 vaccine and I just am waiting for the long-term data. Me personally, I think the mRNA vaccines are brand new and we just need more information. If it turns out that, 10 years down the line that they worked well and there's going to be no long-term side effects, then maybe I'll take the vaccine if COVID's still a big issue. But where I'm at right now, I'm pretty happy with my decision. As far as healthcare goes, I think that we could use universal healthcare in this country. I know that's a very hot topic and I'm not sure how you feel about it. Maybe I don't know that I've ever actually talked to a nurse one-on-one about how would you feel about universal healthcare. But I do think we need it in this country. How we pay for it is complicated, but yeah, I think we could definitely use universal healthcare. So every citizen, if you break a leg or you're in a car accident, you don't have to worry about a $50,000 medical bill if you don't have the right insurance.
Yeah. Wow. Yeah. No. So like, here's the other thing. These are great topics. So another thing I wanted to throw out there, if people are still listening, is there is a Patreon, like I said earlier, we're going to kind of release, and of the different tiers, for those who want to, and there can be like a one-time show up or one-time guest that you can try this out, but there will be meetups where even in Crypto Matt, if you'd like to be there too to talk about these things, it'd be great, where I can express the opinions of myself, or, to be able to say that, like, if there is no data, there is no data, like, to have that openness to talk, because, I mean, I do, when I come to Empower, I do want to focus mainly on what is happening in healthcare, what's happening in the community, you know, what, and how is healthcare kind of influencing the community. But no, I'd love these, I'm not throwing that out whatsoever. Please hold on to that. But at the same time too, I want you to be able to, and being a business person, to be able to help promote yourself through that and to let people know that, and those who who really want to have to know that. And if they want to throw out, that's just, it becomes whatever it is. But, yeah, that's just the way I kind of look at it.
I do want to say shout out to my last job. I'm not even going to name them, but my last job, did not require the COVID-19 vaccine. So that is one of the main reasons I worked there while I worked there, cause they did not require a vaccine. So.
Got it. Yeah.
Shout out to them.
Yeah.
You guys were great for not allowing that. And I enjoyed my time there for the time that we're there, but sometimes things don't work out. So.
Yeah. Well, and that's the thing is we had that, choice. I know that even for me, the thing that got me, if I really rewind back to COVID, was the fact that healthcare professionals were given like letters. We were sent letters. We were given letters by our employer to be able to, if we were pulled over by a local authority, we could literally show them we were just going to our job, that we were essential workers. Like that was interesting. Then what became an essential worker? Like that whole process, liquor was open, dispensaries were open, certain things, other things were not like open. A lot of that kind of was interesting. But, yeah.
It was interesting to determine what was essential or not, as if like people themselves couldn't determine which businesses should stay open or whatever, Yeah. But that was a crazy time in 2020 when they were closing everything down.
Yeah. We could probably even have a whole series on that, I think, in general and beyond. Yeah, for time and time again, I think we'll talk about it. But, yeah.
It's definitely a time in history that most of us who are, even the oldest of adults probably have not witnessed anything like that in their life, as far as, hey, we're going to lock this whole country down, the businesses are going to close, etc.
So I guess for me, what would be like an empowering piece of advice that you would give to someone looking to go into, what is it you say you're doing, mining or whatever it is, any kind of work, I guess, or any line of work whatsoever too, if it's whatever it is. And they can include as questions to ask prior to employment, or even think about themselves if they're thinking about being their own financier and, employer themselves. They continue to drive through that passion that I can see you have today.
My best advice for most people would be to do what you love. And maybe if you're doing something you don't love, to maybe think about switching over to at least part-time of doing what you some people do like working 60 hours and they love the grind. I personally don't even like working 40 hours. I would rather, enjoy time outside or do whatever. Maybe I should be a park ranger, some people would say, because, if I want to be outside, then I should work outside. But me personally, I would say, you just enjoy life. Like I said, if you enjoy working 60 hours, then do it. But if you don't enjoy work, then hey, work 20 hours and maybe enjoy your life a little more. Not everything and everybody needs to buy the most expensive thing, but that's just my opinion.
No, I dig it. Thank you for that. And I'd love to have you back as a guest if you'd like to come back.
Sure.
Here's the part, where we go ahead and we close, with an empowering quote or quotes, that were picked here by your own guest, folks, and I just didn't know if you want to go ahead and this is the time. Go ahead, Matt. Crypto Matt.
Let me think for a minute, but a good quote for basically anybody. It's not really healthcare related, but it's just be happy. Sometimes the life in the world throws things at you that you can't always handle. And obviously I'm not saying be happy every single day, because I'm not happy every single day. But when you can, and look around and appreciate life, whether maybe it's out when you're out and walk in the woods, or maybe it's out when you're on a date with your loved one, whatever it may be, just look around and say, hey, I'm happy and I'm going to appreciate this time. And I would say be happy.
Wow. I love it. All right, folks. So this was episode 22 with Crypto Matt. Thank you all for being here, and we're signing off for now. Bye for now.